Imagine living with a condition where no matter how hard you diet or exercise, the fat just won't go away and it's not your fault. Well, that's called lipedema, often referred to as the painful fat disease. It affects millions of women across the United States and around the world. Despite its tremendous prevalence around the country and around the world, lipedema is still poorly understood, often misdiagnosed, and often left undiagnosed, even by healthcare professionals. So today I want to shed some light on lipedema, talk to you about how it's different than obesity, how it's overlooked, and how it might be affecting you or somebody you love. Hi, I'm Dr. John Chuback. I'm a board-certified cardiovascular surgeon. I specialize in venous and lymphatic disorders, and one of the things that I've become really involved in the last few years is lipedema. You know, I have another podcast here on YouTube called the Lymphcast Podcast. I work with my dear friend, Dr. Emily Eicher, another dear friend, Dr. Monica Glavitsky, and we've had many patients with lipedema on the show over the last 2.5 years. And I think that we're finally helping to bring attention to this disease and give those patients the respect that they deserve, quite frankly. If you're not familiar with lymphedema, please check it out. Again, my colleague Emily Eicher has been specializing in lymphatic disorders and lipedema for the last 30 years out in Santa Monica, California. She's really given me a tremendous education over these last few years working together. You know, lipedema is a chronic fat disorder, causes an abnormal accumulation of fat disproportionately located in various parts of the body, but it usually incorporates the lower half of the body. And we're going to talk a little bit about the types of lipedema in just a minute here. It's definitely not the same as obesity, and it's definitely not caused just by poor diet or lack of exercise, for sure. This is a genetic and a hormonal condition that affects millions of women. Some studies estimate that as many as 1 in 10, or about 11% of women in the United States, may suffer from lipedema, although the vast majority of them probably go undiagnosed their whole life. Certainly, the problem is hugely underdiagnosed, misunderstood, neglected in many cases by the medical community. So that's one of the reasons I think it's so important to make these videos, not only to educate the public and bring awareness to what might be happening with their own body, but to other physicians and healthcare providers as well. The misdiagnosis is simply because people are not getting the training. Doctors and nurses, therapists, all kinds of healthcare providers are just not getting the training about lipedema in their schooling. And so that's why channels like this are so important, to bring this more sort of esoteric information to the mainstream so people can learn about it and then do their own research and get deeper into it. But as I said, lipedema is resistant to diet and exercise. That we know can be really frustrating, and it can be associated not only with physical pain but with emotional pain and distress for patients. Unlike general obesity, which tends to accumulate fat relatively evenly throughout the entire body, lipedema fat is typically distributed what we call disproportionately, usually in the hip and thigh area and the buttock area, while the waist and the midsection, the torso of these ladies, tends to remain relatively small. That's sort of the hallmark body type or body shape, sort of a pear shape in the lower body, what we call the phenotype of the patient, or the physical manifestation of the disease and how they present and how they look. And generally the diagnosis is made that way visually by a very knowledgeable and experienced physician or clinician, nurse, etc., like myself, that can look at a person and say, you have lipedema. There's no blood testing for it. There's no genetic testing for it. So you want to be looking for that smaller waist, larger hips, buttocks, and thighs, and it tends to run in families. The other thing is we see what we call cuffing, what sometimes we refer to as a baby doll kind of a look at the arm or the ankle. You know how a child's doll often has, you know, that babyish look where there's a fat pad on the forearm, and then at the wrist there's an abrupt line before the hand or before the foot. That's very classic, highly indicative of lipedema. When you see that, you have to be thinking lipedema. The other thing is these patients, you may have, or a family member may have, what we call lobules. Lobules are sort of overhangs of the fatty tissue, which you don't normally see in generalized obesity or people with increased body mass index. These lobules on the inside of the knee, sometimes quite dramatically on the saddlebag area or the lateral buttocks and upper thighs. And it can be somewhat mild, but it can also be quite dramatic. Another area that you can see is the arm. The arm can become very disproportionately heavy, especially especially the upper arm, sometimes creating what we call a bat wing deformity. When the patient holds the arm out, you'll see a large amount of fat hanging, again, a lobule around the elbow area, which can be quite indicative and classic for lipedema. We're going to go over the different types. Again, it almost always is found in women. It runs in families. There's clearly a strong hereditary component, but as I said, no specific gene has yet been identified. And lipedema patients often report tenderness to being touched. Even when we examine them in the office, especially patients who have, let's say, lipedema with venous disease, where we do compression examination to test the veins and their function and flow, those patients will be very tender, acutely sensitive to the touch. Oh, Dr. Chuback, or to one of my vascular technologists, please, be very careful with me. I'm very tender, and we examine patients each and every day with the same technique. So right away, oh, this patient is hypersensitive. Something is going on here. They also generally and very frequently tend to have easy bruising. They just have to be touched or gently bang into something and a big bruise can form. So that's another very characteristic sign of lipedema. They may also have nodularity under the skin, nodules, what feels like painful lumps under the skin. These are quite common. And they could also be related to another related condition called Derkham's disease. And we can talk about Derkham's in another video sometime. It's a little bit outside of what we want to focus on here today. All lipedema patients can have some nodularity to the skin or to the fatty tissue beneath the skin. And we're going to talk a little bit about the staging of lipedema. And again, we're going to talk about the fact that staging lipedema and the types of lipedema are two very different, but both very, very important subjects. The other thing that's really important to talk about is the fact that lipedema, not always, but very often carries with it a profound emotional and psychological, psychosocial aspect to it. Many patients may experience depression, anxiety, social withdrawal due to their appearance, and also the misunderstanding they face from healthcare providers. Being told that nothing's wrong with you when you know somehow inherently that there is something wrong can be devastating, quite frankly, for people. And this feeling of being marginalized or disregarded as having a serious or important problem. So as physicians, we have to be very sensitive to the emotional aspects of this disease and not just provide medical treatment, but also empathy and support. And when necessary, in more significant cases, even professional services with a therapist, psychologist. The other thing I should mention to anybody out there who thinks they might have lipedema or knows they have lipedema, who has been diagnosed, there are some really terrific support communities out there, many of which can be easily accessed and joined online through different social media platforms. Here on YouTube, for example, that would be something you could look for. Hopefully get some sense of support and understanding by being around others who have this problem, and to realize maybe for the first time in your life that you're definitely not alone. And as I said, it's definitely not your fault. In being with others in a community who's going through or who are going through the same sorts of things, not only physically, but the feelings, it can be very, very comforting, and it can be very therapeutic, can be very healing. So I hope that for those of you who are in that category, you'll investigate that and reach out for support in some of those areas. On the other end of the spectrum, fortunately, some new interventional treatment options are beginning to emerge, mostly liposuction. Liposuction is now being performed more and more for people with lipedema. We've had several specialists as guests on the LymphCast podcast that do a very, very specialized form of liposuction for lipedema patients to recontour the body and to help reshape the body and help bring much more normal sort of contour and silhouette to the body, not only from a cosmetic point of view or a visual point of view, but in many cases also very functionally. One of the places that I've seen a significant problem or a significant issue in my patients who come to see me here in the office is especially with the medial knee lobules. Those medial knee lobules can cause a obstruction in a normal gait and being able to walk properly. And when the gait has to be adjusted to walk around these lobules, when that gait has to be modified to walk around those lobules, now you change the whole gait in terms of the pelvis, the hip girdle, the hips, the knees, different stressors on the feet and ankles. So that can lead to a lot of orthopedic problems and injuries in the joints, the ligaments, tendons, etc. Hopefully for the right patient set, surgical intervention can bring a lot of people great results. The other thing that's a new trend which is obviously very, very hot, is the weight loss medications, diabetic medications that are now being used frequently for weight loss, like Ozempic. Some of the early research is showing that lipedema patients tend to be more resistant to weight loss, but there are varying studies. This is all emerging. But the one thing is for sure, lipedema patients do not lose weight selectively in the areas of disproportionate fat distribution. So generally speaking, with or without medication, when weight loss does successfully occur in our lipedema patients, they can expect the body silhouette or morphology, the shape of the body, to generally maintain its same shape, so that if it's an enlargement of the hip and thigh and buttock area, they will relatively be bigger than other aspects of their body or other areas of their body because of the lipedema. And that can be frustrating, but still can be very gratifying for people who do successfully lose a significant amount of weight through nutrition, exercise, and movement. I think that this is worth certainly discussing with your primary care physician. Various aspects of weight loss, nutrition, diet, exercise, physical training, even surgical options. Your physician may be surprised to know that you know about this. It may be new to him or her. So don't be surprised if you bring the subject up if that's the case. Some experts in the field who are very highly interested in lipedema are strong proponents of a ketogenic diet. I think my understanding and our review of this kind of data on the LymphCast podcast, discussing it with Dr. Eicher, ketogenic diet works great for some people and not for others. So the evidence is certainly, I think, inconclusive that it's certainly some sort of holy grail or magic bullet, but it's something you might want to try, again, under, the supervision of your healthcare provider. But different diets work for different people. So there might be something that works for you. There are so many out there right now, as you know, vegan, vegetarian, carnivore. Keep trying till you find something that you're comfortable with, that's healthy, and that is going to work for you to find your best individual results. I know this is a little bit controversial, but I'm still a great believer in calorie management. It's not everything. It's not the end all and be all for sure, but certainly you don't want to be taking a hugely excessive number of calories, no matter how you're bringing those calories into your system and into your body. Some degree of calorie assessment and management, I think, is essential for weight control for all people, not just those with lipedema. I think walking and swimming are both excellent exercises for people with lipedema. Everybody who watches my channel knows Dr. Chuback loves walking whenever it is possible as a low impact, strengthening, cardiovascular, cardiopulmonary endurance exercise without having to get up into the aerobic zone. Some aerobic walking with hills and fast pace can be valuable too in the right circumstances. Make sure that you're in the condition to do that. Check with your doctor before working hard with hills and inclines and very, very fast-paced walking. But I think walking is terrific. But the one that I want to mention here for sure is Dr. Eicher's favorite for her lipedema patients, and that is swimming and aquatic exercises. The swimming is obviously no impact, zero impact for patients who might have trouble walking because of body changes, lobules, etc. Swimming is great, and so are aquatic exercises. So look into that as an option, which will also help with your lymphatic flow, which we've talked about on other videos here on my channel. Now, let's talk about the stages of lipedema. Lipedema is generally broken up into 3 stages. Stage 1 is an early stage. It's characterized by smooth skin, but the underlying tissue may just begin to feel nodular or lumpy. There may be a little bit of swelling. Not every lipedema patient develops swelling, but certainly some do. But in stage 1, you would have smooth skin, nice soft fatty tissue underneath, and minimal, if any, swelling. And the area might feel a little bit cooler to the touch in some patients, but that's not particularly common in my clinical experience. In stage 2, the skin becomes more uneven. That uneven texture or feeling becomes more pronounced and a little bit more painful, sensitive to the touch, tender to the touch, a little bit more swelling, and then you start to see that bruisability, that easy bruisability come into the situation, and you might get some hardening with a little bit of fibrosis, fibrotic tissue beginning to develop under the skin and the fatty tissues and the soft tissues, and they become become tougher and more irregular. And then finally, in the most advanced stage 3, the tissue under the skin becomes very, very uneven, lumpy due to large protruding fatty nodules and to swelling. Patients will often develop persistent pain then and very easy bruisability. And the skin can become hard and thickened with signs of inflammation and even some secondary lymphedema and lymphatic fluid accumulation in the soft tissue and in the deep layers of the skin. Now, with regard to staging, it's a 3-stage process, but now we're going to switch gears and talk about the types of lipedema. There are 5 types of lipedema, and the 5 types are as follows. The 5 types of lipedema are based on where that abnormal fatty tissue is primarily building up. So in type 1, the fat builds up primarily in the hip and buttock area, whereas in type 2, the fat accumulation accumulates between the hips and the knees. Type 3 has fat building up from the hips all the way down to the ankles, often with prominent cuffing at the ankles. And then type 4 is where you'll have involvement of the arms. All patients with arm involvement of lipedema, remember upper arm mostly, although the forearm can be involved with cuffing at the wrist and lobules at the elbow, that would be a type 4 patient. And then type 5, which is quite rare. In my practice, I don't think I've ever seen a real type 5 patient, but that's defined as the patient who only has lipedema changes in the calf area below the knee, and the thighs, hips, buttocks, arms, etc. are all completely normal. So I think that understanding the staging and the types of lipedema are important for knowledge and awareness, but also may guide your personal treatment options and personal expectations. I think it was important to go over that. Well, remember that lipedema is a real fat disorder, finally getting the attention that it deserves. It is not your fault, and it's not just about diet and exercise. It's about understanding your body, advocating for yourself, and finding the right support, both medical and emotional. I'll be creating more videos to dive deeper into topics like Derkham's disease and also about specific exercise routines, nutritional strategies, anything that I think could be helpful if you or somebody you care about is suffering from lipedema, what we call the painful fat disease. If you found this video helpful, please subscribe and hit the notification bell so you can be reminded all the time to be living a healthier and happier life so that you don't miss future videos. I hope you'll share my channel with friends that you think would find it helpful, and we're going to continue to try to spread as much knowledge as we can about lipedema so that we can help more people find the answers they've been searching for. Thank you for watching, and please remember, you're not alone, and always consult your physician or medical professional before starting any treatments or exercise programs. I think that that's a really safe and smart thing to do. So thank you so much, Dr. Chuback.